Hello, everyone. This is Dr. Santos, and we're going to quickly talk about thesis and capstone projects. Hopefully, by the end of these next few minutes, you'll be able to describe what a thesis is and a capstone is, describe how this process in general works, and hopefully we'll walk away with a few ideas, at least from past classes, and hopefully will inform what you might be thinking for your own work. So what is a thesis? What is a capstone? Both theses and capstones advance the current body of literature. That is the whole point of doing these master's theses. But they're slightly different. A thesis typically is known as doing original research, while a capstone advances literature by applying what's known, to see what's working, to see how this can be applied in a certain setting or with these circumstances. They're both based on theory and conceptual frameworks, and both must address program competencies. But a thesis is done alone, while a capstone is typically done in groups. Now, looking at different maybe general subtypes of these types of projects, a thesis project might be a primary data collection project where you're actually creating and observing new data. And hopefully that data will be analyzed and will be able to answer your research aims and goals. Secondary data analysis is still analysis to answer your research aims and goals, but data already exists. So there might be existing databases from the California Department of Public Health, or maybe other sort of databases about national health surveys or COVID data, right? Infection rates by country or by state in the United States. A literature review is a little bit different because you're looking at literature instead of collecting data points on outcomes. But the idea is that you are still trying to answer a specific question and setting up research aims and goals to learn and answer that question. But the idea is that you're not just reporting on the literature, right? That's part of it. But you're really showcasing that you can go through the literature, understand what these basic public health concepts are, and then appropriately pull out literature that helps, again, answer this public health research question. Capstone subtypes, however, in general can be thought of as either developing something or evaluating something. Right? You might create education materials as a group around healthy eating, for example, or develop a program to increase physical activity. Now, there might be some primary data collection involved, but the primary gist of, say, a capstone for program development might be to create a physical activity program that helps adolescents increase their physical activity per week. A program evaluation, you might do that in terms of your own program development, but you could also look at, say, existing county programs. Does the county's vaccination program actually increase vaccination rates? So that might be an easy program evaluation piece. How do you get started? There are lots of milestones through here, and we'll walk through them. But the idea is that you start now and start early. Identifying a topic means that you should have some sort of interest, something that you might want to study. And hopefully, if you don't have an interest already in mind, that your coursework will expose you to these different facets and aspects of public health. Maybe there's a particular population that you want to study. Your committee is minimally 2 members. Now, the committee is the folks who evaluate your work at the end and guide you through the process. 2 members, one of them being a chair, who's sort of in charge, and that person must be one of the 4 of us, Department of Public Health faculty. The second member can be from the department or from another department on campus, but essentially it is someone else who is relevantly degreed in public health, master's level or higher. Now, with the other milestones, you'll find that in your last foundational course in 507, you'll get a lot of this done. You will work on specific aims and goals, develop your proposal overall, including the background justification and your methodology and analysis. That will be presented at the end of 507 for that 507 class grade, but you also would need to work with your committee chair that you've identified to finalize your proposal so you can advance to candidacy. Keep in mind that the 507 grade and your advancement to candidacy to start your thesis work are separate, although related. Now, as you are going through the rest of your coursework, you will be simultaneously working on your thesis that you proposed at the end of 507. That will go through the next several months. And again, your thesis defense will be at the end of the next year that you start. So December start, you defend, fall start, you defend December the next year. Spring start, you defend April, end of April the following year. Here are some general questions. Yes, people do graduate on time. If you don't, there are ways to deal with that. But again, our standard program is a year and a half. Forming groups for capstones probably should be thought of early, right? In your 501 class at the very beginning, think about people who might share the same ideas as you, or maybe are thinking about things in the same way. And you hopefully are getting that through class discussions or posts. There are no real disadvantages, but the advantages differ depending on the project and the person in the group. Through these next slides, here are some ideas of what a health promotion or a global health thesis or capstone might look like. C equals capstone and T equals thesis. I'll let you read through that on your own, but know that there's a variety of things you can do in either concentration. The ways that you look at global health can be a little daunting because it's not so evident, but know that almost anything can be considered global health depending on the perspective and the frameworks and the particular points of inquiry, your research aims and goals. It all depends on those pieces and how that comes together. But here again are more examples of global health topics and ideas. Finally, I'll end here. I'm a little over time at 7 minutes, but this is sort of guiding you to where most of the general public health information is located, specifically around your thesis and capstone information. All you do is go through community.csusm.edu and log in using your student information. Every student should be registered with Masters of Public Health or MPH Central. And hopefully you'll be able to see this just like you would any of your classes, but at least in this space, the community space versus Cougar Courses space. If you have any questions, please let us know. We have faculty available to you. And of course, my name is Dr. Santos. You can find me either via email or setting up time with me if you'd like to chat. All right, have a good day.